Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today we're here at the HIMSS 2022 conference, and we're here with Amato Amarain. He's CFO of the medical group at RWJBarnabas Health, and also with Nora Lissy. She's VP Healthcare Consulting and Implementation at Dimensional Insight. Welcome.
Thank you. It's nice
Thank you for having us.
Here.
Yeah, so I'm excited for this discussion, but Amato, why don't you kick us off? What is your vision and really your goal when it comes to leveraging data in your organization?
Sure. My vision is really disseminating the information out to the users of the organization to ultimately bring value to the organization, but the key is transparency. And not having access to the information really prevents them from initiating the change that is needed to add that value. And really, ultimately, I have a finance background, is you need to get to the margin to really contribute to the mission of the health system. And that's, for me, a key way to get it is the data out to the individuals, the users, and then they can initiate the action plans.
Yeah, it's interesting you talk about transparency. Many in healthcare are afraid of transparency. Why do you embrace it? Or is it about embracing it internally because it empowers, or what's the...
It's a combination. It empowers the user, it empowers the leadership. But one of the things I find out is data is so complicated. What it does is it initiates improvement of the data itself. Because as people start looking at the data, they start seeing things that either on the front end or in some of the translation or the interfaces that occur, there's problems. So for me, that transparency is what initiates the change in the value add at the end of the day.
Yeah. Nora, is that what you hear from your other clients? Dimensional Insight works with a lot of healthcare organizations. What do you hear from them?
Same thing, and oftentimes we'll find when we're doing implementations and we're working with customers to develop that transparency, they will often have a lot of aha moments like, oh, we didn't realize that field isn't even being populated as frequently as we think. It's something we're using as a quote unquote tracker, but if the other people downstream don't understand the value of the data and why we're using it, you don't get that value. And they often will find that as we go through our implementations that, well, we have to go to this field now, or we have to fix this process because it's not doing what we expected it to do. And it's all in the same journey, is to have transparency and have the entire organization understand their goals. And if they can see the data and they can understand what they're talking about, then everybody's on the same page.
Yeah. I mean, Dimensional Insight is known for bringing kind of disparate data sources together into one consolidated view. Is that the other aha moment, is like when you go across multiple systems and you're like, oh, I didn't see it here and I didn't see it here, but together it's like, oh, that's a bigger picture?
Oftentimes you have, we still don't have interoperability in the EHRs even. I mean, there's a couple of them out there that definitely have much better than others, but the reality of it is you still have a freestanding lab system, or you have a cath, or you have somebody collecting data on an Excel spreadsheet that actually provides value to what the numbers are on that finance puts out every month, and nobody knows where that number comes from. You have the ability to put that all together into one view, and it makes a huge difference for the organization and allows them to start to marry things together, outcomes and finance. So we're making the financial cuts. What are they doing to our outcomes? Are we getting the outcomes we expect with the financial cuts, or do we have to weigh that out? So they kind of see the two together.
Yeah, it makes sense. Why is it so hard to consolidate across these disparate systems?
Because the definition can be different to every single person. You could probably ask everyone in this conference, what is your definition of total patient days? And every single one of them will probably give you a different answer. And how do they use that total patient day number? So it's really, a lot of that it comes in with being able to not only bring the data together, but then expose what the measure name is and how we achieved it. Oftentimes you go to meetings, and Amato, you can speak to this, you go to a meeting and 3 people from 3 different areas have a different number for their volume. The same volume we're all talking about, but it's because I pulled it from the source system. Oh, I got a SQL query, and oh, so-and-so called me and told me their number. None of them match because it's all different routes they took. So this allows you to kind of keep it all in one place.
That's great. Amato, do you have that same problem? I mean, defining what is, patient days or et cetera?
Absolutely. And it's a great, it's if you ask 3, 4, 5 people the same question, you get different answers. We prefer to have that one source of truth with a consolidated or definition of each of those measures. And there are some interpretation issues that we get as we go along through this process. But bringing disparate information in, lining that up is the key to understanding the full spectrum of the understanding that's needed to initiate change and value add.
Right. I mean, if you want actionable data,
Yep.
you've got to give them that information, but they have to understand what that means for people to react to it.
Yeah. So Amato, why don't you just use the EHR? I mean, EHRs have been trying to make the case that we are the single source of truth, and why don't you just push everything in there?
Yeah, great question. They're a single source of truth for a small piece of the information. The grand scheme of data that gets distributed is a lot more than what's in the EHR. And the EHRs are limited in what they can do. They don't like external information. They really don't bring in so much of the history, the legacy information, where Diver and Dimensional Insights have done that for us. They've allowed us to have a forum and a platform to bring history and all this disparate information and bring it together. And the beauty of Dimensional Insight and their team is they understand what all those different data elements are and how they marry together. And then to Nora's point is you do see things and how things are set up that initiate change on the front end that make it a lot more user-friendly in the back end and in the reporting side of it.
I mean, what you're going to there, it sounds like to me, is really good data governance.
Yes.
Right?
Correct.
Across disparate systems. Talk to us about that and talk to us about the role that technology plays in making sure that there's good data governance.
So talking specifically about Dimensional Insight is their setup allows for just automatic data governance. As you bring in the data, there's checks and balances that occur along the way. And quite honestly, they're not only the governance audit tool that we use as well for some of the source, and the EHR. The EHR we find without the proper training and education is not utilized properly.
Interesting.
So it is a source of truth to initiate change on those front end products.
So it provides a tool to be able to audit what's going into the EHR? Is that
Absolutely.
what you're describing? Interesting.
I'd like to add to that one question you talked about earlier too. One of the things why you just can't use the EHR for your reporting is because the reporting tools will give you what's in the EHR, and you know, garbage in, garbage out. So oftentimes what your other tools will do, something like a Dimensional Insight tool that does the extraction and translation, that's where we build the rules around it. We understand your data, and that's when we expose that you're using an incorrect field or you want to do this field, and that allows for then, I think over transition of time, the EHR then becomes more complete. But until we get to that point, you still have garbage in, garbage out if you're just taking reports out of that system and not really seeing the backbones. Because those usually come from like summary tables and summary areas where we go right to the raw data and we're able to show you what that raw data is doing. So that makes the difference in the process.
And one other area that is important to understand is the security and disseminating the data. In the EHR, there's limitations. With Dimensional Insight, you can set this up any way. It becomes a great management tool, allows you to disseminate to different groups. So you can organize it in so many different ways. And that's what the beauty for me of Dimensional Insight is. It allows you to take whatever data is and break it out in any way and send it out to disparate groups. And one source of truth, though, it comes out of that.
Yeah. It's fascinating to think about Dimensional Insight actually improving the data in the EHR, which I think that's a beautiful message there. Because at the end of the day, I look at data and I think it's all about, do your users trust the data? So Nora, maybe you could talk to us, like what does it really take to make it so customers, you know, your customers and the users of these systems really trust the data?
We go through painstaking hours and hours of validation. We have varying levels. We'll start at the first layer where we bring in that raw data. And before we even apply any business rules to it, we want to make sure that our raw data matches exactly what your raw data is in your system. So that if we both do something and we write the same rule, we should have the exact same answer. So that's the first layer of validation. Once we've determined that yes, we have the matching files, we will then apply business rules. Then we do validation over those business rules, and we don't just do it with, oh, John, let's go over here and do. We make sure we're with the end users that are going to use that data, because if anybody can tell you, it's, you know, if you don't reach out to your end user and ask them, or at least show them what you're planning to give them that's going to help them, you'll never get them to buy into it. They have to be a part of it. They have to understand that I'm putting this together for you, so you give me your answer. If you don't like it, tell us so we can fix it. So we do a lot of back and forth like that, and I think that's one thing that we do super well that some other vendors, even when I was a customer working at a hospital system, you don't get that same kind of, it's kind of like, okay, we're done, sign the paper and you're done. We don't ever go away, right, Amato?
No. Partners for life. And it's
almost to a fault, we never
no,
go away.
No, it's not a fault at all. It actually is a great, we applied that same philosophy. The transparency with the key stakeholders and the users with that data helps contribute to a better product. And what we find is that trust is there. Once they see that we're giving them everything and we're exposing them and giving them the opportunity to provide feedback, you get the buy-in right away.
Yeah. Well, I think that's an incredible message, that transparency into the process, transparency into the data builds trust with your users.
Yes.
So
Absolutely.
Thanks so much for taking time to sit down with us, and thanks so much for sharing all your insights and perspectives. And thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks so much.
Thank you.
you.